Hello, I am Dr. Rajendran. I am a consultant neurologist at Apollo Hospitals, Greens Road in Chennai. And on 11th of April, we have the World Parkinson's Day. So today I am going to talk about what is Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that occurs because of loss of dopamine producing cells in the brain. And the name occurs because Dr. James Parkinson described a condition called shaking palsy in his paper, which was published in 1817. So what is Parkinson's disease? How does it manifest? The Parkinson's disease occurs mainly with the following symptoms. The tremor is most common symptom. Then you have rigidity and bradykinesia and postural instability. So I am going to explain what are these. Tremor is nothing but trembling or shaking. It usually starts on one side and is associated with rigidity, that is stiffness of the limbs or sometimes the trunk, and the patient becomes quite slow, that is called bradykinesia, and the balance, there is imbalance on walking due to postural instability. The disease occurs usually in older people, 60 years and above mostly, but very rarely it can occur in younger people as well. When it occurs less than 50 years, it is called young onset Parkinson's disease. With proper treatment, most individuals with Parkinson's disease can lead an active, productive life. The life expectancy is almost the same as other people, and the most symptoms which I described are motor or movement related. Other symptoms also can occur, like psychological symptoms like anxiety, depression, and there can be an increased sweating. Some people have diminished sense of smell, and they can have difficulty swallowing or hypersalivation. In advanced cases, sometimes dementia can occur. So what are the other conditions that can mimic or resemble Parkinson's disease? A group of conditions called atypical Parkinsonism, like multi-system atrophy, progressive supranuclear palsy, corticobasal degeneration, or conditions like Lewy body dementia and even sometimes stroke can mimic Parkinson's disease. Stroke occurs when certain parts of the brain called the basal ganglia gets involved. Then the patient can have Parkinson's like symptoms, and that is called vascular Parkinsonism. Other conditions like essential tremor and certain drugs and toxins can produce Parkinsonism, which is called drug-induced Parkinsonism. The neurologist would be able to differentiate these conditions. Early and accurate diagnosis of Parkinson's disease is important in providing good quality of life. Generally, neurologists after examination may want to do some tests. Sometimes you can do a brain scan, mainly to rule out other conditions which mimic Parkinson's disease. So what are the treatments that are available for Parkinson's disease? Currently, there is no cure for Parkinson's disease because it is a progressive disease. However, many treatments are available mainly for improving the symptoms. And one of the most commonly used drug is levodopa, which eventually improves the secretion of dopamine. Other medications are also available like dopa agonists, amantadine, and non-medication such as physiotherapy and rehabilitation are also useful. Very rarely when the patient do not respond to drugs, then a surgical procedure called deep brain stimulation, otherwise called DBS, it is available, where microelectrodes are placed in the brain when it stimulates certain parts of the brain that causes improvement in the symptoms. The first step in diagnosis of Parkinson's disease is to see a neurologist, where other conditions like essential tremor which can mimic Parkinson's disease should be made. So after establishing the condition, that is Parkinson's disease, there are good drugs that are available, and it has to be taken for quite some time, and patient can live a good quality of life. And thank you very much for patient listening.